So what I want to do is highlight that will then tie into what we heard earlier today, and really open some doors to what I believe are some really interesting next steps and questions we can ask. So what I want to really think about is if we look at a lot of the examples we saw, they can really be classified in two major areas where you had a robot that could possibly do something on its own. You could probably think of this as like autonomous surgery. Maybe you taught, the robot to do a particular thing, but more often we want these robots to actually work alongside human counterparts. And so this notion of having a robot collaborator or a cobot or an assistive robot is a really challenging prospect, but one that we think is worth investigating. So if we look at such a system, you can think of the robot as an entity. You can think of the complex task or environment, in this case, possibly performing a surgical operation. And you can think of the human collaborator or user that's going to be working with this co-robot. And so traditionally, we have these robots that are actually observing these tasks and environment. And really over the past decade, you see these tasks becoming more and more complicated and us using more and more amazing tools to actually accomplish these tasks. So when these tasks become highly sequential, when the state space is very large, how can we get out the information we need in order for the robot to take the key actions to work effectively to perform the tasks or environments? So we heard a lot of referral to like the self-driving car community. These robots need to be good, they need to be repetitive, they need to be reliable, and they need to be able to be autonomous. They need to be able to understand the world and their place in it. But now we have this human collaborator, and this is really challenging because often it's really hard to ascertain exactly what the human wants to do and how you should work alongside them as an effective teammate. If I had multiple robots, it's really easy to possibly share essential information between robots. But when you have a human collaborator, that information exchange is a lot harder. And so possibly the robot is able to both perceive the human as well as take action on the human. And then finally, the human is perceiving the task and environment and taking action themselves to complete that task. And so if you think about what the robot needs to know, right, the robot needs to have a model of itself, understand how it operates, how it works. It needs to have a model of the task so that it knows how it should interface to complete the objective. And then it needs to have a model of the human collaborator so that it can effectively be a teammate as it completes these tasks. And so often, we have the robot that is able to perceive and act on the human, but if the human is working alongside the robot, then the human might also be taking action and perceiving the robot. And so the human may be learning as they go along. And so one of the interesting tools to think about is how can we actually query this space? So if we look at the interface between the human and the task and environment, right, we want to actually understand how the human is interfacing with the task and environment directly and how to use that information in the human model so the robot knows what they need to do. So one term that you heard a couple times today was the mixed reality or augmented reality. This, I think, is a fantastically rich research space because it allows us to directly intercept what the human perceives in their environment. And so this is fantastic when it comes to how do you actually want to essentially extract the human intent from as minimal amount of information as possible. You can think on one end of the spectrum, the complexity of how it takes to set up this communication method. You could have programming something by hand. If every time you want to do a new thing, this is extremely laborious. And then on the other end of this spectrum, you have possibly verbal communication, but it can take a long time to describe the task. And then you can think of possibly haptic information. Can I feel something in my environment? And then maybe gaze tracking and mixed reality as some of the simplest ways to essentially indicate intent. And so what's also interesting is this notion of using these haptic interface devices. So the human may be taking some action on the environment, but if you can actually intercept what the person may feel in their tool, right, this can actually give you much more information about the underlying mechanics of the problems that were being solved. And so, what's fantastic here is, this directly correlates to some of the last points that Jada was mentioning. I think like the ease of use and teleoperation, right? These actually go to correctly extracting that human intent. And I think that this is a strong space for co-robots. And then he also mentioned portability. And I think one part of that, right, is having a robot that can sometimes update its internal model to complete a task better. So sometimes, if you have a task, right, this is set. We want to, as he mentioned, you know where you want to go, right? You know where you want to do the particular surgery, and you have the human who has some set of skills that they're trying to do to accomplish this. So the robot has to work within its own structure to allow the human to complete that task. But in some instances, you may even have a robot that's able to change its configuration to accomplish that action better. And for that, Allison has some very interesting ideas, so I'll hand over to her.
Thanks, Monroe. So Monroe and I had discussed earlier about what are some really high-level ideas to think about, especially to conclude this wonderful session today with discussing the sort of human in the loop aspects and how do we bring the human in, both as a entity to be perceived and understood, as well as something to work collaboratively with the robot. So with that framework, I'd like to switch modes a little bit and think about some issues related to the mechanical design of robot. Of course, Jada covered this extremely well in terms of all of the detailed considerations that go into this. And what I would like to riff on is the need to really rethink the design of robotics. And this is something that is happening in the soft robotics research community. And I'm going to share a slide. I can just get my screen sharing going. Oops. Monroe, can you hear me now? My screen just went blank, which does not seem good. Okay, well, my screen is totally blank on my computer, which is not a good sign. So I'm just going to talk through it. Please, oh, I'm back. Okay, maybe I won't show that slide because that was dangerous. So what I was going to talk about in soft robotics is the idea that the body of the robot can be designed to much more effectively integrate with humans. So one example, like the very thin, small surgical robots that have described are robots that can operate on a range of scales, not just in surgery, but also on a human scale. So for example, soft robots, which was also mentioned in terms of the work going on at seismic robotics, that are soft and wearable and can actually manipulate the human body. And because of their low-level physical properties, are really good at interacting with tissue in a safe and appropriate way, in terms of appropriateness being human acceptability of interaction with those robots. And I think what is especially interesting is a class of robots where you can change their joints to be in different locations. So many of the robots that we want to create to go into the human body or even assist in the human body around it are of this long, thin, skinny form factor in a sort of needle-like form factor. And we'd like to be able to move their joints around to be whatever they like. And since my slide was making me nervous, instead I'm going to try this instead and share a video. So let me see if my computer is happy with this. Yes, this seems much safer. So I'm showing a video from a recent PhD student, Nathan Yusevich, and his collaborator, Zach Hammond, where they've created a robot, which is in this case in a truss formation, but it's made out of thin, lightweight members, in this case pneumatic members, which are formed into a truss structure, but each one is effectively its own soft robot, and it can bend and interact with people very safely. And one of the really interesting things about this, as you see it now start to actuate by itself, is that the location of the joints on the robot itself effectively change, and this allows it to change shape. So we don't need to think about robots anymore as being entities that have, say, fixed joints in space, but that can curve and tightly rotate at different locations on their body. And this, I think, adaptability in terms of the physical instantiation of the robot is also really critical to this overall idea of adapting to the task, adapting to the human. And there are many challenges, of course, in terms of the robot understanding its own model when you have this type of system. And maybe I'll toss it back to Monroe. Maybe you'd like to talk more about issues in perception.
Yeah, so just pulling that in. So if you can change your configuration, right, the question is, right, what is that ultimate target that you're trying to do for the task that you're trying to complete? So in that space of perception, right, you're trying to actually ascertain what the final goal objective is of your task. So I would say, like, it's really interesting to think about how do you actually extract your target state of your system? How can that actually be ascertained? And if you can ascertain that information, then you can really understand your role with the human and how you should actually change your configuration to achieve that target state. So perception is a huge problem to actually achieve that. So we mentioned, like, mixed reality is one way to communicate. You can use cameras to extract this information. Haptics play a huge role in being able to extract this information. Some of these tools for surgery that are actually able to collect that information, as one of our previous speakers mentioned, right, when you're actually trying to normalize the performance in surgery, you need that data, you need that haptic data. It's a very rich space. How can you actually extract that? So there's haptic information, there's visual information. All of this needs to be effectively used to extract the key information you need to understand what your target goal is for whatever action you're trying to complete. And on the intelligence side, right, you have this huge information space, you need to distill it, right? How do we correctly distill it? And I think over the past few years, there are a lot of amazing tools that are coming into play, particularly in the learning space. One would be autoencoders, right? How do you extract the key features of the task that you're trying to complete in order to do this complicated task?
So in Monroe's model that he showed about the human and the robot and the task, one of the key things that he highlighted was this point of mutual adaptation, which is that as the robot perceives and adapts to what the human is doing, one thing we often don't consider in the robotics field that I think needs a lot more attention is how the human adapts to the robot. And as an example, my colleague Steve Collins at Stanford, who designs prosthetic limbs and exoskeletons, is doing human in the loop optimization of the wearable devices such that they adapt to the human's gait and try to optimize something about the subjects, the way that they walk, or maybe their oxygen consumption and things like that. But the challenge is that simultaneous to that device adapting to the person, the human is changing their behaviors based on the haptic interaction, as Monroe mentioned, and maybe even changing targets, changing goals for the human task as they discover perhaps new capabilities. And so bringing back to this idea of the mutual adaptation is that the robot is adapting to the human and the human is adapting to the robot. And I feel like in our field, we don't have models of where this sort of emergent adaptation is going to end up. And this is, of course, an interesting question when you have just information systems, but when you have physical interaction and these adaptations are happening in real time, and potentially there are safety issues associated with this physical interaction, understanding the mutual adaptation that occurs is something that I think researchers are just barely starting to scratch the surface of. And this is something, especially in medical applications, that we need to consider as human and robots are working together, whether it's a surgeon performing surgery on a patient. In this case, the second human, the patient, is usually inert, laying on the table. And so the human that the robot's interacting with is, of course, the surgeon. But then in other applications in rehabilitation, it's really the human who is receiving the healthcare who is physically interacting with the robot. And then you have this particularly vulnerable population sometimes with a variety of deficits that aren't well modeled, including things like vision and poor proprioception post-stroke. How a differently abled individual would handle this kind of mutual adaptation is totally unknown. So this is a great opportunity for us to start exploring the challenges of adding AI into human machine systems that have physical contact.
Absolutely.
Monroe, would you
And I
like
think,
to chime in next?
yeah, I think this actually blends really nicely with a question actually we received just now on really how do you actually get a good model for understanding the target, the goal that the
Yeah.
situation that the robot is trying to help the human with. How do you have that shared situational awareness? And so again, right, this is brand new territory, brand new space, in my opinion. But I think some ideas to think about, right, is, for that, thinking about how you actually describe that goal. How do you combine that information? Perhaps this is where we want to leverage these new tools that are emerging in mixed reality, in haptics, to help the human user describe that target to the robot, describe that end state. We want to, for instance, remove this tumor completely. I can use my MRI to tell you where this is, but now on the ground, right, if we have sensory and perception for both the human and the robot, right, if we can make these parallel perception tools, how can the robot and the human actually work together, to accomplish this? And so I really was very impressed looking at that video of the Monarch. I loved it. And I could just think, like, one way to even make that cooler would be if the human could actually be looking at the patient and leveraging, for instance, mixed reality to see what was going on. But regardless of the technique to do that, right, if you have this human user, right, who's trying to complete this task, right, going back to this mutual adaptation case, right, maybe if you understand what the final objective is of your situation, you don't always have to assume that the human's actions are actually going to be perfect or optimal. And so I think another interesting thing in this adaptation is, usually we look at robotics as being simply supportive of their human users, but if you have a clearly described objective, then perhaps if the robot is able to clearly model the human collaborator and the objective is agreed upon, right, maybe the robot can also take actions that aligned with that objective may actually help the human to actually have the entire system have a better optimal performance. So you can imagine, if you wanted to reach a particular spot and you had multiple paths to get there with your surgical tool, right, the robot may have a probability of success being higher if you took one path versus another, right? And so if a particular surgeon has a probability rate of choosing a particular direction that would lead to a less favorable outcome, how can the robot help guide the human to make the better choice, the higher probability choice? And if the human begins to rely on that robot's ability to help give them interesting and positive suggestions as they go to complete that task, you'll have this mutual adaptation, which will lead to a better combined system, two minds, one goal.
Ideally.
Ideally.
Yeah, so another way to think about this is, and Monroe and I had discussed this earlier before we when we were brainstorming on what kinds of things we wanted to talk about, is the idea that you can perturb the human a little bit to see how they respond, to understand their goal or their target better. With a mixed reality system, for example, you could do this with a visual display. You could also sense the reaction, for example, by looking at eye tracking. In fact, a number of robotics researchers working with systems like the Da Vinci have started embedding eye tracking so that they can understand what their robot is doing in the context of what the human is actually looking at. But this next step that I'm talking about is providing some kind of perturbation, whether it be haptic or visual, to understand then how the human reacts to that perturbation in order to achieve the task. And it's a little bit like doing a mini system identification. Ideally, you wouldn't need to do such a thing. There's also this whole idea in human robot interaction of legible behaviors. It's sort of like a physical instantiation of legible AI, right? That if I want to move my hand around an obstacle to a particular location, that if I was clearly going to move around the obstacle, I would maybe move further around it than I would need to, so that my behavior is very clear to the robot. But robots can also do the same things. Humans can do the same things to other humans, as well as robots and people can do that to each other in order to improve understanding.
And I would just add on. Oh yeah, go.
Sorry, I just I wanted to ask both of you in this discussion, just to because we only have a few minutes left, but I wanted to see if we could first thank you so much for the points and your dialogue here. Let me just interject though about COVID-19. Mm-hmm. How is that changing the picture for either of you in terms of research and questions you're looking at and applications?
Yeah, sure. So I can start with something it's very practical actually, which is that we've been in the process of designing soft robots and thinking about how we move air around. And so when you think about ventilators, for example, could growing soft robots, this is something that Elliot Hawks is doing at UC Santa Barbara, have growing soft robots that actually grow into the trachea in order to provide a good path for air, as well as how do you use the sort of soft robotics knowledge of pneumatic systems in order to improve ventilation. But that's very much like on the low level hardware side. On a higher level, of course, many of the things that have been discussed are important to us as robotics research as well, in terms of what is the assistive technology that allows people to remain remote from each other while still providing a physical assistance and connection. And of course, a lot of these obvious ones are related to helping someone get out of bed, providing someone with their medicine, helping them take them to the bathroom. But then there are others that are maybe more subtle and maybe seem a little bit superfluous right now, but we may get to a point where this is important. And that is the importance of touch and tactile interaction between people for our social and emotional health. So we are also thinking about, I guess, dovetailing on work that we've been doing in terms of haptic feedback for social interactions, devices that give you a pat on the arm to say good job, or a stroke to say it's okay, and understanding how do people interpret these. You worry that if there's an uncanny valley for haptics, you don't want to gross someone out by touching them in the wrong way. And so when we think about this sort of touch interaction for social and emotional health, this might be something that is increasingly needed for remote interactions. So those are the things we're thinking about. Monroe may have more.
Yes, I would say particularly within the COVID-19 applicability space, this notion of how do you have remote robotic agents that are effective surrogates for people, I think is a very critical question. And one of the earlier speakers, may have been our first speaker, even mentioned like this is extremely hard when you think about manipulation, when you think about beyond just how do you manipulate to complete these complex tasks? But if you have to add into that scenario, if I have to touch people, how do I carefully handle people as well? If I want to lift you from a wheelchair into a hospital bed, this is a critical question. Even before COVID-19, if you think about one of the biggest reasons that we have turnover in nurses, it's because heavier patients cause them physical issues when they're trying to lift them. And so if you can have these robots that can work alongside nurses, can bring to the scenario robotic strength, robotic acuity, right? This is a critical question that needs to be answered. So particularly within our lab, one of the questions we've been asking for the last few months is how can we actually have a robot that can carry an object cooperatively, with a human, right? We have many different spaces, right? We have intelligent prosthetics. We have robotic assistants that are helping on a macro scale, which could be in disaster relief or even in a hospital. But a consistent attribute across these are, right, you want to bring that robotic strength or bring that robotic repeatability and allow them to be effective teammates to do that. And within a COVID-19 space, then if you can train a robot to be an effective teammate, then possibly they can also easily serve as an effective surrogate. I think that application space is wide open for us.
Thank you. That's great. I think it also relates to the idea of the smart bed that could somehow pneumatically turn patients or avoid them getting bed sores, especially when these, you know, the ventilator patients who are immobile for, you know, weeks at a time. Very interesting. Okay.
Yeah, absolutely. The robot can take a very different form from what we typically think of as a manipulator in order to, say, move around and change a bed position and the contact between the human and the bed. Absolutely.
Absolutely. In some instances, the less a robot looks like a robot, the more acceptable or successful it can be. I think we have time for another question from Russell Taylor for Monroe, but Allison may want to comment. One of the difficulties with surgical robots, especially for collaborative robotics, is developing a good model of the task and then to map that understanding onto the model of changing anatomy. And representational issues seem to be very difficult here. What are your thoughts on developing shared situational awareness and how can it evolve?
Yeah,
I think
Russ. Oh, yeah. Go ahead, Monroe.
No, Allison, please go ahead.
I was gonna say I know Russ well, and he's very interested in such questions. So thanks for asking this. So you know, lower cost, accessible medical imaging is necessary for us to know in real time what the tissue state is in surgical robotics specifically. And the changing anatomy is just extremely difficult to predict during a surgical procedure, because even if you have great real-time imaging, you can't necessarily plan ahead because you don't know how the tissue is going to react after you are in the process of performing an intervention. And it's also, it seems now nearly impossible to develop some of the models because, for example, there's no non-destructive way to measure the fracture toughness of tissue. You know, when will it break or when will it cut? And so these predictions are extremely challenging. But I think a shared situational awareness that can occur might happen more from, rather than doing the low-level modeling that we've been trying to do in this field for a long time, but rather from using large data sets and models that are you know, formless, I guess, in a way, that can be developed over a long time, over large data sets that can help predict what will occur at the end. Monroe, do you want to chime in?
That was a fantastic answer.
Yeah.
Yeah, I haven't had too much time to look at that particular question, but I totally agree, right? You know, these things are very hard to model at a low level. And so I think, as Allison mentioned, right, data aggregation that will allow us to use some of these non-parameterized models to model these situations, I think will be very crucial in developing techniques that would make them effective in these combined situations. Yeah.
Yeah, and I think there's going to be an interesting trade-off here. There was a great question from Jeremy about trust and how it is a medical professional or a user who's like a patient. How do they gain trust that a robotic platform is a good solution? And in our old methods, you know, we could have pages of proofs about the stability of a teleoperator control system, but we often can't have those same types of proofs. We have to back it up with lots of data, potentially simulations, and demonstrations in environments where patients are not put at risk.
Well, those were great answers, and I want to thank everybody who's contributed fantastic questions. It's my timer going off right now. Please, we're going to collect them all. If we weren't able to answer them directly, we're still very interested. Thank you, Allison. Thank you, Monroe. Again, a really fabulous talk, and I just miss the combined applause that we would normally expect at this point.